Welcome back to Live at 9, and it's a Wellness Wednesday with Mississippi's favorite doctor, Dr. Quinn. And Dr. Quinn, Friday is Valentine's Day, a nice day. It seems like a positive holiday. However, we're going to talk about broken heart syndrome. So just break this down for me real quick.
Broken heart syndrome. Initially, I had never heard of it until I was doing my residency in Los Angeles. A lady came in the emergency room with all the signs and symptoms and history of a heart attack. We admitted her to the hospital. We did a lot of tests, including cardiac enzymes, which were elevated, which made us have high suspicion of a heart attack. But when we did the history, we learned about broken heart syndrome. Apparently, she had a boyfriend that she loved, and he had multiple girlfriends that he liked all of them. But on Valentine's Day, he had to make a decision, and she was not the one. She was all dressed up. She got her hair done. It was so beautiful, but he didn't show up for the date. And when she learned that he was on a date with someone else, as he called her and told her he had to come clean, she was in a restaurant and she started getting chest pain. They called the paramedics. They did an EKG. It was abnormal. They brought her to the emergency room and we admitted her for a heart attack. When we did additional testing to include a cardiac cath, it was negative and she got the diagnosis, and I learned about broken heart syndrome, a real medical diagnosis.
Yeah, I guess my follow-up question to this is, do people tend to have these symptoms maybe, near holidays when they've maybe lost a loved one? So, maybe take someone that's lost their husband or wife that they were with together for 60 years, and then, Valentine's comes around, and maybe is that the time where someone might have this?
Most definitely. And if you look it up, broken heart syndrome is a real medical diagnosis that's usually brought on by a very emotionally stressful event, like the death of a loved one. Someone actually got it when they won the lottery. They won like $1 million and they started having chest pain, and they did not have a heart attack, but they had broken heart syndrome, which is a real medical diagnosis. It's just a lot of endorphins released in a very emotional reaction to something very stressful.
Is there a way to deal with it if you have this? I mean, how do you get diagnosed, I guess, with this?
Well, usually you'll get diagnosed in the emergency room. Like I said, the initial what's called cardiac enzymes, which is the blood test for damage to the heart, are elevated. The EKG is off. But when you get that stress test where they look at the arteries of your heart, usually it's normal. But the echocardiogram will even be off a little bit. It'll show the heart in a different shape. But this diagnosis is it can be a fatal. People can lose their life, or they can have long-term heart damage, such as heart failure. But for a healthy person, usually they come out okay in a few weeks.
So it's not always, I guess, losing a loved one necessarily. I mean, you could have broken heart syndrome from all other things. Like you said, winning the lottery. I mean, I know there's been times where, coaches retire and soon after they actually pass away. And you could say, well, maybe they were just broken heart because they're not doing what they love anymore.
But usually it's a stressful event that could be pinpointed. Like, for instance, you got that call, you won $1 million. Oh my God. Yeah. Or the guy you love, he's going to marry someone else. You learn that right then. It's usually a very emotional, stressful situation that can be pinpointed.
Interesting. And what does it have signs that are kind of like? I mean, you said maybe not a heart attack, but you said, you have some of those signs.
Right. Chest pain, heartbeat just beating real fast. You can feel your heart beating, fatigue. Some people faint. But it's a real medical diagnosis. But here's a take home. The better physical condition you're in, if you do have this condition, the better chance that it won't hurt you long term. So exercise, eat healthy, maintain the best health you possibly can so your body will be ready if you do have an episode of broken heart syndrome, and you have a better chance of recovering fully.